Today I'm going to discuss respirator protection from 29 CFR Part 1019, Subpart 134. I'm going to provide you with why you should wear a respirator in the work environment, show you a few different respirators along with their parts, provide you with certifications that should be followed in regards to respirator equipment, how to maintain and care for the equipment, and medical information which will help you become knowledgeable in which case a respirator will be less effective. Before we begin, please understand that this training is mandatory, so please listen carefully and take something from this class. The only exception to this training or any training session in regards to respiratory equipment includes if acceptable training has been provided from another employer within the past 12 months. A refresher course should be completed annually or if the work environment changes. If an employee fails to use the equipment properly or any other situations that give reason for retraining. Before we go any farther into this lesson, does anyone know what is respirator protection? Respirator equipment is worn in order to prevent illnesses that could be caused by contaminants present in the air that could be inhaled in. Two examples of respiratory equipment include a full face mask and a half mask. A full face mask covers the eyes, the nose, and the mouth, and a half mask covers the nose and the mouth. Let's go over a few parts on a couple of face masks. The quarter mask includes a face piece, an inhalation valve, an air purifying element, exhalation valve, and a headband. A half mask includes a face piece, an inhalation and exhalation valve, air purifying element, filters and cartridges, and a headband. A full face mask includes all of the above that was listed with a replacement lens, a center adapter, and an eyeglass frame and mount. Now as a class, can you help me figure out the pieces on the mask? I'm going to give you approximately 1 minute to figure out which part goes where. How many of you think you completed the matching successfully? Take a look at the slide to determine if your answers are correct. Now we're going to continue our discussion, and we're going to narrow this training session down into only talking about non-IDLH atmosphere respirators. The term non-IDLH means not immediately dangerous to life or health. Non-IDLH atmospheres are contaminated atmospheres which can be caused by particles, gases, vapors, fumes, mist, and airborne hazards generated from specific work processes. Does anyone know something that would give a reason to wear a respirator but would not cause immediate danger to someone's life or health? Some examples of non-IDLH chemicals include chemical treatment and coating, spray paints, paints and primers, and pneumatic sanding and grinding on hazardous materials. I told you about non-IDLH atmospheres. I'm going to provide you with some facts in regards to respiratory training. If a respirator is necessary to wear in any environment, employers must use the assigned protection factors, which is also referred to as APFs, that meets or exceeds the required level of employee protection. When using a combination respirator, such as an airline respirator with a purifying filter, employers must ensure that the assigned protection factor is appropriate to the mode of the operation in which the respirator is being used. The picture shown to the right of the text shows what an airline respirator with a filter is. When determining which respirator to use in a situation, be sure your respirator can maintain your exposure to the hazardous substance when measured outside the respirator at or below the maximum concentration, also known as MUC. If the MUC exceeds the IDLH level or the performance limits of the cartridge or canister, then employers must set the maximum MUC at the lower limit. A respirator selected shall be appropriate for the chemical state and physical form of the contaminant. For protection against gases and vapors, the employer shall provide an atmosphere supplying respirator or an air respirator purifier, provided that the respirator is equipped with an end-of-service life indicator, also known as ESLI, ESLI, certified by NIOSH for the contaminant, Or if there is no ESLI appropriate for conditions of the employer's workplace, the employer implements a change schedule for canisters and cartridges that will ensure that they are changed before the end of their service life and describes in the respirator program the information and data relied upon and basis for the change schedule and reliance on the data. The employer shall also provide protection against particulates, which include an atmosphere supplying respirator or an air purifying respirator. The air purifying respirator must be equipped with high efficiency particulate air filters, which is also known as HEPA, certified by NIOSH under 30 CFR Part 11, or with filters certified for particulates under 42 CFR Part 84. Or an air purifying respirator equipped with any filter certified by particulates by NIOSH or contaminants consisting primarily of particles with mass meeting aerodynamic diameters of at least 2 micrometers. Now that we have discussed employee responsibilities, we're going to talk about wearing a respirator. Can any of you handle wearing a respirator? In order to determine if you can handle wearing a respirator, a physician will evaluate your health by asking you different questions. All of this information is confidential. Also, the evaluation must be set up at a time and place that is convenient to the employee. The physician will also determine your tolerance to the respiratory equipment and find out if any medical conditions that will reduce the effectiveness of the equipment or cause you to be at risk for any serious illnesses. Can any of you come up with what would reduce the effectiveness of the respiratory equipment or could cause serious illness from a previous illness? Some medical conditions can increase the risk of having serious medical conditions if a respirator is used, such as cardiovascular and respiratory disease, reduced pulmonary function caused by other facts, such as smoking, neurological or musculoskeletal disorders, impaired sensory function, such as reduced hearing or smell, and psychological disorders which might be claustrophobia or severe anxiety. Having a cold or a cough, for example, can cause an individual to have trouble breathing, which can lead to dizziness or even cause the employee to pass out. So before you assume that you are healthy enough to wear a respirator, be honest with the physician who is evaluating you so you don't enter into a dangerous environment and cause yourself problems. Now that you have learned the parts of respirators and the medical issues in regards to respirator use, you will now learn how to take care and maintain your respiratory equipment. Before using any respirator, you must clean and disinfect it. You will learn how to disinfect a respirator when you complete the fit test in another training session. Cleaning and maintaining your equipment is necessary in order to keep the equipment working effectively and not to transmit any germs. Also, clean the equipment before use, especially if the equipment is being shared among many employees. To be safe, you should always clean the equipment before you use anything, even if it is your personal equipment. Always check the filters or cartridges before use in order to determine if the equipment will protect you from harmful atmospheres. Remember to always keep things from the mask seal to keep a good suction to your face. Now that I have provided you with all the basic information needed to understand the equipment and its limits, let's review what we covered. First, I will show you a video covering the things we covered during this training session, and then I will ask you a few questions. Now that we have reviewed the topics covered in this training session, I'm going to ask you a few questions to see what information you retained. The first question is, what is respiratory equipment and what does non-IDLH mean? The second question is, what is MUC? Why is it necessary to complete a medical evaluation before wearing respiratory equipment? Last but not least, why is it important to wear the proper respiratory equipment? after today's training session, I hope that all of you have learned how important it is to always check your equipment before you use it to make sure it's working properly. And I hope that the information you have learned today will help you understand future training classes on respiratory equipment.